Hi, this is Dr. McCain. I'm here with my assistant Chad, and we're here today to demonstrate the cervical performance test that's exclusive to the approved preferred system. Okay, so we're going to be using the dynamometer. It should be set on high threshold, and I like to use this curved pad. It's a little bit more comfortable for the patient, and it conforms to the shapes of the skull when we're doing the testing. Okay, now the cervical performance test is we're going to look at all the muscles that move the neck in the 6 planes of motion. Okay, so we're going to be doing the muscles in extension, the muscles in flexion. We're going to be doing left and right lateral bending. And we're also going to be doing rotation. Okay. Now, some of the keys to doing this type of testing and being consistent and having good outcomes is being consistent with how you're doing the tests, okay, how you're setting up the patient. On this test, I like to have the patient not sitting in a stool because they'll tend to use their body and their shoulders a little bit too much. So I like to have them sitting in a chair with the back so that they're just kind of rest into it. And the other thing is that it's really important that you let the patient know what we're going to be doing in the test and what we're looking for. Too often, doctors just kind of dive into the test, and the patient doesn't know where to push, how hard to push. They're just kind of, they're clueless as to what the doctor's trying to get them to do, and then that bogs you down in your test. You have to repeat things, and in that matter. So I want you to do things in a consistent, systematic manner, and that way, it'll be a part of your systems and procedures in your office, and it'll be easy to do. Okay, and also not time consuming. It'll be very efficient. Okay. So we're going to go ahead and get started. You follow the prompts on the software, okay? And I'm always going to tell the patient what to expect and what to do. So, Mr. Patient, we're going to be testing the muscles as you're going in this direction, pushing in this direction, okay? So I'm going to set the pad on the back of the head, and then we're going to be pushing for 3 seconds, okay? So I'm going to slightly put them in extension. That will get them thinking about the direction that they're pushing it. Okay, go ahead and push. Okay, and then you'll listen for a prompt on the software. Okay, that's a 3-second prompt. Then we're going to put them in flexion. Okay, go ahead and push. Okay, and then back off. They're going to be doing lateral bending. So they're going to be taking your ear towards your shoulder. Okay, go ahead and push. Okay, and back off. Put on the other side. Push. Hard as you can. Okay, and back off. Always want to let the patient know that you're taking off pressure, because if you just take the pad off their head, they're going to get jerked and hurt themselves, okay? Now we're going to be doing rotation, okay? So we're going to be going in that direction. Go slightly put them in rotation. Okay, turn, hard as you can, okay? And then we're going to go to the right. Okay, go ahead and turn, hard as you can, okay? And back off. So that's it. That's a cervical performance test, okay? So dive into this stuff, practice, be consistent, and make it a part of anyone that has chronic neck pain, whiplash, disc problems, or any type of cervical ridic. Make sure you're doing this test on them in the beginning of care and during care so that you can measure improvement, okay? Bye. Have a good one.